Welcome to this Step 3 review on the interactive case simulation, the part of the exam where you manage patients inside a software program. This video is brought to you by Roadmap to Residency. In the case simulation, you do not pick from a list of answers. You write orders, move a simulated clock forward yourself, and send the patient to different locations. Our goal today is not to reteach medicine. It is to teach you how to drive the software so your clinical knowledge actually earns points. Make sure you are also practicing on the official practice cases and in your question bank alongside this video. Let us get started. Here is what we are going to cover today. First, a software overview, so you know exactly where the order sheet, the clock, the chart, and the location control live before test day. Second, order writing, because almost every action you take is typed as an order and the sequence matters. Third, advancing the simulated clock, which you control yourself and which is easy to get wrong. And fourth, changing the patient location as they get better or worse. Along the way, we will work through several simulated cases together and explain why each approach is right or wrong. This video assumes you already have the underlying medicine from your review resources. We are here to sharpen how you operate the software. Let us start with a software overview. The interactive case has a handful of core tools. There is an order sheet where you type actions. There is a clock that you advance yourself to move time forward. There is a chart that holds vital signs, results, and notes. And there is a control that lets you move the patient to a different location, such as the ward or home. Learn where each of these lives before test day, using the official practice software, so you spend your energy on medicine and not on hunting for buttons. The key thing to understand is that you do not choose from options. You type free text orders such as electrocardiogram or aspirin, and the software matches your entry. Practice typing the common orders so the matching feels natural. And always read the confirmation so you know the order actually went in. Now let us talk about writing orders that score. The software rewards doing the right thing at the right time. First, order in the right sequence. For an unstable patient, place the truly urgent orders first, such as oxygen, monitoring, and access, before you move on to confirmatory testing. The clock keeps running, so the order in which you act is part of what is being scored. Type the emergent orders and only then advance the clock. Second, reassess after every order. Once you place orders and move time forward, always return to the chart and read the new vital signs, results, and nursing updates. The case evolves based on what you did. Cancel orders that are no longer needed. Add what the new data calls for, and remember the routine items the software expects, such as counseling and follow-up, once the patient is stable. Next, advancing the simulated clock, because you are the one in control of time. First, move time to the result, not past it. Advance the clock to when a result should return, or when you plan to reassess, rather than jumping far ahead. Move in short steps for a sick patient, and longer steps for a stable one. Second, do not outrun your sick patient. The most common simulation mistake is advancing the clock too far while a patient is unstable and missing the chance to intervene. If someone is critically ill, move time forward only briefly, reassess, and act. Save the long jumps for stable patients waiting on a slow result. Third, use the clock to reassess. Every time you advance, treat it as a scheduled check-in. Read the updated chart, respond to what changed, then decide how far to move next. Let us work through our first simulated case, and this one is about your opening moves. A 60-year-old man arrives in the emergency department with crushing chest pain that started 1 hour ago. He is sweaty and anxious. The case has just opened, the order sheet is empty, and you have not advanced the clock yet. The question asks for the best first set of actions inside the software. Notice that nothing has happened yet because you have not moved time. Look at the 4 options and decide what you would enter first, then we will walk through the reasoning together on the next slide. Let us break this down. First, read the situation. This is an unstable patient with a possible heart attack in progress, and the simulated clock has not moved, so there is still time to act. Your job is to place the emergent orders immediately, then let time advance only a little to see the response. Next, drive the software. The best answer is to place the electrocardiogram, oxygen, aspirin, and cardiac monitoring right away, and then advance the clock briefly. That mirrors real care and matches how the software rewards urgent action, so the correct answer is the second option. Now, why do the others fail? Advancing a full day first abandons an unstable patient and is the classic clock mistake. Moving him to the ward before stabilizing skips the emergent care he needs. Ordering only one tracing and then waiting delays the treatment that changes the outcome. The correct answer is to place the emergent orders now and advance time briefly. Here is our second simulated case, and this one is about changing the patient location. A 40-year-old woman is seen in the office for a simple urinary tract infection. She is well, with normal vital signs and no warning findings. You have confirmed the diagnosis and you want to treat her and send her home. The question asks for the best way to complete this visit inside the software. The key is to match the location to how sick she actually is. Pick your answer and we will reason through it on the next slide. Let us work through this answer. First, match the location to how sick the patient is. The location control lets you move a patient among the office, the emergency department, the ward, the intensive care unit, and home. A well patient with a simple infection belongs at home once she is treated, and choosing the right location is part of what the software rewards. So the correct approach is to prescribe the oral antibiotic and then use the location control to send her home with follow-up. Now, why do the others fail? Admitting a well patient overnight puts her in a location that does not fit a mild illness. Sending her to the intensive care unit is a serious over-triage that the software penalizes. Keeping her in the office for weeks makes no use of the location control at all. The correct answer is to treat her and then send her home with follow-up. Let us put location changes to work more broadly. First, move with the level of care. When a patient improves or worsens, change the location to match. A stabilized emergency patient moves to the ward, a patient who is deteriorating on the ward moves to the intensive care unit, and a patient who has recovered goes home. The software watches whether the setting you choose fits how sick the patient is at that moment. Second, do not forget to discharge. A very common slip is treating a patient correctly but never sending them to the right final location. Once the patient is stable and the plan is complete, use the location control to send them home or transfer them, and place the routine follow-up and counseling that a real physician would arrange. Finishing in the right location protects the points you have earned. Here is our third simulated case, and it is all about advancing the clock correctly. A 70-year-old man in the emergency department has severe pneumonia with a dangerously low oxygen level. You have already ordered oxygen, fluids, and antibiotics, and you have confirmed they are placed. The question asks how you should advance the clock next. Think about how sick he is and how far it is safe to move time forward. Choose your answer and we will reason through each option on the next slide. Let us break down this answer. First, use short steps for a sick patient. This man is critically ill, so the clock must move in small increments. Advance time a little, read the updated oxygen level and vital signs, respond to what changed, then advance a little more. This reassess and act rhythm is exactly what the software expects for an unstable patient, so the correct answer is to advance time in short steps, reassessing at each stop. Now, why do the others fail? Jumping a full week abandons an unstable patient and is the classic clock error. Refusing to advance the clock at all leaves you frozen and lets nothing progress. Skipping a whole month ignores every chance to reassess and rescue him along the way. The correct answer is to advance time in short steps, reassessing at each stop. Here is a software pearl that ties everything together, and it is a simple loop you can run on every case. First, the core loop. Place the orders the patient needs right now, advance the clock a sensible amount for how sick they are, then read the updated chart. Repeat this order, advance, and reassess loop until the patient is stable and your plan is complete. This rhythm keeps you from either freezing in place or racing ahead of the patient. Second, before you finish, reassess one last time and move the patient to the right final location, whether that is home, the ward, or a transfer. Cancel any order the patient no longer needs and add the routine follow-up and counseling a real physician would arrange. A clean finish in the right location protects the points you have already earned. That wraps up our review of the interactive case simulation. Remember the core ideas. Learn the software layout so you never waste clicks on the order sheet, the clock, the chart, or the location control. Write orders in the right sequence and always reassess after each one. Advance the simulated clock in short steps for sick patients and longer steps for stable ones, and move the patient to the location that matches how sick they are, all the way through to a clean discharge or transfer. The best way to lock this in is to rehearse on the official practice cases and in your question bank until it feels automatic. Visit roadmaptoresidency.com for expert tutors and residency advisors who can help you build a personalized study plan. If you found this video helpful, please like and subscribe so you do not miss our next board review session. Good luck on your exam, and we will see you in the next video.